This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, everybody, and thank you for joining us for our HealthyU Webinar Series. Today's topic is what is healthy heart living? At any time during the presentation, please feel free to answer any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted once the presentation concludes. Your questions will remain anonymous. Today's presenter is Dr. Gruberg. A native of Bolivia, Dr. Gruberg graduated from the School of Medicine at the University of San Simón. At 25 years old, he emigrated to Israel, where he worked for 20 years, completing a fellowship in internal medicine and cardiovascular diseases, working at hospitals and teaching at the Sackler School of Medicine of Tel Aviv University. During this time period, he took off to do research as a Fogarty Fellow at the National Institutes of Health in Bethesda, Maryland, as part of the Human Genome Project. He later completed a fellowship in interventional cardiology at the Washington Hospital Center in Washington, D.C., where he later became the director of pharmacological trials. Dr. Gruberg, and I'll hand it off to you.
Thank you very much, Jonathan, for that introduction, and thanks everybody for attending this talk. I will be talking a little bit about what is a healthy heart living. We will touch on things that probably you've heard along your life, but we will try to get the new things that are available to our knowledge right now. So talking a little bit about the pandemic, I think it is important for me at least to understand how important this pandemic was in the lives of everybody in the United States and in the world because of the tremendous effect it had on our life. Oops, sorry about that. If we look at here, here we have a chart since the first cases were described in the United States in 2020, and we can see the spikes in admissions that we could see during the different waves of the COVID-19 pandemic that we had. And here we have the mortality. Unfortunately, this was a very deadly disease, and we can see that starting very early in 2020, we started seeing these peaks and valleys of people dying from this horrible disease. This is the mortality in the United States. As we can see, until 2023 in the United States, there were more than 100 million cases that were diagnosed with COVID-19. And unfortunately, more than 1 million people had died by this time in the United States. And I think that is very important to frame it into the actual mortality and morbidity that we can see in patients that have cardiovascular diseases. If we look at this graph, we can see on the left that the mortality that is associated in the United States with cardiovascular disease continues to be the #1 killer in the United States for the population. Obviously, cancer comes in a very close second, and other diseases are trailing down. We've made a significant progress in treating cardiovascular diseases since the 1990s, and we can see that the mortality has come down. And if we look at this graph, we can see the mortality in green. From the 1950s, there was a very high rise in mortality from heart disease during the 1950s. That's when a lot of people felt that smoking was very healthy and good for you and was very cool. And then in the 1970s, 1980s, we started realizing that smoking is not so healthy, and people started taking better care of their health, and mortality from cardiovascular diseases started coming down. However, as people started living longer, the mortality for cancer has been creeping up, and we can see that it has gone up more than triple since the 1950s. And that is because more patients are diagnosed early, and also because people are living longer than in the past. Putting all this in perspective, here we have the mortality in the United States, and we can see the peaks and valleys through the years for cardiovascular diseases. You can see, I don't know if you can see my cursor, but on top you have cardiovascular diseases, and it goes up during the winter months, and then in the summer it kind of goes down and up again, and we see that's a circadian rhythm during all these years. In the light blue, we can see mortality for cancer, pretty straight line. And then we have that huge peak in mortality for COVID-19 that surpassed cardiovascular diseases during that horrible year. And if we look at cancer versus, if we look at the cardiovascular mortality in the male versus female patients, in the 1970s, mostly men were having cardiovascular mortality. And then women, as they took a very important role in society, got equal rights, equal bad habits, mortality for women started to creep up and actually became higher for women. And then we started the whole series of teaching for women a healthy heart. And right now, mortality for men and women are very similar for cardiovascular diseases. Obviously, there is much more work that needs to be done for both men and women so we can reduce the mortality for this disease. If we look at the whole world, we know that every year more than 18 million people will die from heart disease. 1 out of 3 mortalities in the world will be caused by cardiovascular mortalities, and more than 75% of these mortalities will take place in low and middle income countries. So this is not only a disease that affects, widely developed countries, it also affects other countries in similar fashion. And there are some risk factors. We will be talking in more detail about these risk factors for cardiovascular disease. We all know what they are, such as high blood pressure, high cholesterol, overweight and obesity, pollution, physical inactivity, the unhealthy diets, diabetes, smoking, chronic kidney disease, and the harmful use of alcohol. And like I said before, we will touch these in more detail. I think this is another part of our green statistics, just to show that more than 1 out of 4 patients in the United States will have an elevated bad cholesterol. The cholesterol, as we know, there's good cholesterol, there's bad cholesterol. The bad cholesterol is the low density cholesterol, which is the LDL. And about 1 in 4 people will have elevated levels of the bad cholesterol. And in the average, about 1 person will be dying from cardiovascular disease every 34 seconds in the United States, for a total of more than 2,500 mortalities every single day in the United States from cardiovascular disease. And if we look at strokes, we can see that every 3 minutes we will have somebody having a stroke in the United States, which will lead for more than 400 deaths in the United States alone from stroke every single day. This is a map of the United States, and we can see here in the dark red the areas where we have the highest mortality for cardiovascular disease, and we can see in the light brown places where cardiovascular disease is more controlled. And obviously we have places like the northwestern part of the United States where people are very conscious about healthy habits, where mortality will be very low. And unfortunately, in the southern part of the United States, where people are not so aware, we see that there is a very high pocket of very high mortality from cardiovascular diseases. And this is a very important event. Obviously, it has very important economic connotations, and about more than $200 billion will be used to cover these health costs for this disease. Talking a little bit in more detail about the heart, I like to talk about the heart that is in the middle of the chest. And the heart is a muscle in itself. And as a muscle, it needs blood supply. And the heart gets blood supply from 3 arteries that are called the coronaries. One will go to the right and to the bottom of the heart. And then the two other arteries will go to the front of the heart, being the most important one, and one will go around to the left part of the heart. So these three arteries are very crucial, and they will provide all the blood supply to the muscle of the heart so the heart can function properly. As we can see in this graph, we see that these arteries are like little tubes. And as we get older, these little tubes, these arteries, get clogged with cholesterol. Unfortunately, this plaque of cholesterol starts building very early in our life. And if we're not careful enough, this plaque of cholesterol eventually will clog the whole artery and stop the blood flow to a very important part of the muscle of the heart. And if that is very rapid or abrupt, that can cause a heart attack. And if it is a slow and insidious process, eventually will lead to the loss of function of this part of the heart, leading to heart failure and other diseases. Like I said before, if there is a clot or a clogging of these arteries of the heart, patient may have a heart attack or just have what we call angina, or it's chest pain, chest pressure, which usually will start when we do something strenuous, effort or something like that, and eventually it may happen at rest. And when we have a heart attack, usually it is at rest, and it's prolonged and it's persistent, and it may be associated with other symptoms such as shortness of breath, being sweaty, being nauseous, and it's a little different among men and women. Women will have more weakness, more abdominal pain, maybe some nausea, some vomiting, whereas in men, it's more the classic symptoms of chest pain radiating to the left arm. Nowadays, we can do a very crucial management of patients that have blockages in the arteries of the heart. We can do a catheterization. We can get to these little arteries of the heart from the groin or from the arm. And from there, we can go and open the blockages that are preventing the normal blood flow to the muscle of the heart. In a case of a heart attack, we can go immediately and try to open the blockage that is causing the heart attack. And most of the procedures that are being done nowadays are being done from the wrist. And at Mather Hospital, where I work, I do about 80 to 90% of all my cases are going to be done from the wrist, which has very good outcomes. In some other cases, we still go from the groin, which is a classic access to get to the heart. And it is still being used in about 50% of all the cases in the United States. Once we get to the little arteries of the heart, here we can see on the left side a diagram that shows us the plaque that has built in the little artery and that it's clogging the artery. And we can go and try to open it up first with a little balloon and then put in these little tubes of metal, which are called stents. Here on the right side, you can see the size of these little tubes that we put inside the arteries. They're very, very similar to the springs that are that we see in ball pens, and they're about the same size, and they go inside the artery and they scaffold the artery from the inside, preventing the plaque to protrude inside the lumen of the artery. And in this way, we have normal blood flow to the muscle of the heart. The majority of stents that we use currently are what we call medicated stents. They slowly release a medication that is going to prevent the re-narrowing or scar tissue formation in these stents. And the chances of that happening now are extremely, extremely small. This is a case that I did a couple months ago, and we can see this is a catheter that is coming from the wrist at the top. At noon, you can see the little catheter injecting dye in the right artery, the right coronary artery, and we can see that it stops in the middle of the artery, and that's where there is a blockage that causes the heart attack. And we can go in the same fashion and try to open this blockage. Like I said before, here you see a little balloon in the middle portion of this artery, opening the blockage in the artery. And here you can see this is the final the final picture. You can see we have opened the artery successfully, and we can see that we have restored blood flow to the bottom of the heart when this patient was having a heart attack. On the left, again, you can see before, and the right, you see the after result. and the results are incredible. And patients after having a heart attack usually will go home within 24 to 48 hours if there are no complications. Like I said before, we do this procedure now from the wrist. The patient is able to immediately stand up and sit in the bed or in the couch, and then go home 4 hours later if this is an elective procedure. In some places, we don't even have beds anymore. We have these couch, these kind of lounge areas where patients will be sitting, recuperating from the procedure for a couple of hours, and then they will go home. So this has changed significantly in the last couple of years, and I think this has been a very important advance in science. This was the plumbing portion of the heart. Like I said before, there are 3 arteries. They will provide the blood to the heart, just like the plumbing will provide the water to our house. But what is very important in a house, it's also important in the heart, and that's the electrical system of the heart. So the electrical portion of the heart is very important because that electricity is what will start the contraction. So the heart can do and contract every single time, more than 70, 80 times per minute for all our lifetime nonstop. And we can capture this electricity that moves around the heart with a very classic electrocardiogram that everybody has seen. And we follow these electrical waves so we can understand how the heart is working based on these electrical waves. Sometimes the electricity of the heart stops working in the appropriate way, and some people may need pacemakers. And these are little batteries that are inserted in the top of the chest. They have become extremely smart nowadays, very small, very smart. They can capture a lot of information about what is happening in the heart. And in the past, we used to connect this little battery to the heart, to the inside of the heart with this electrical wire. And some of the pacemakers that we insert nowadays, they don't even have wires. They just go inside the muscle of the heart, and they do whatever they need to be doing, providing the electricity to the heart in a controlled fashion from the inside of the heart. And they can be programmed from outside the heart without any wiring or anything like that. And this has been a tremendous advance. And like I said before, we at Mather have these different type of pacemakers available for all patients if they need one. Also, we have made significant advances in arrhythmias. Sometimes the heart, the electrical portion of the heart is not working properly and has what we call an arrhythmia. These arrhythmias can now be treated. We can go inside the heart with little catheters and do what is called an ablation. We can take care of these arrhythmias, and we can cure some of these arrhythmias, such as atrial fibrillation. Atrial fibrillation is one of the most common arrhythmias that we encounter in cardiology, and now it can be cured just by going inside the heart and doing some mapping and using very small catheters. We can actually cure atrial fibrillation, which is very important. In some cases, we are unable to perform all our provide all the services at Mather Hospital. So some patients may require coronary bypass surgery. This is when the patients have multiple disease. So in these patients, we need to do a bypass graft surgery, and this bypasses the blockages. And for this reason, we transfer our patients to different hospitals where they can have the care that they need. One of the hospitals that we work very closely is South Shore University Hospital, what was called Southside in the past, and now it's South Shore University Hospital, part of the Northwell system. And it has been named one of America's top 50 best hospitals for cardiothoracic surgery in the whole United States, which is pretty impressive, I think, having some of the best results for cardiothoracic surgery in the whole United States. Changing gears a little bit, we're going to talk a little bit about prevention of heart disease. In the past, we used to talk about these light, simple 7 things that we needed to do, which is obviously have a healthy diet, control our weight, do exercise, non-smoking, controlling our blood pressure, controlling the cholesterol, and controlling the diabetes. In the last couple of years, we have added one more to this, and now it's called Life Essential 8. And as you can see at the top left, it is sleeping. Sleeping has become very important for heart disease. We know that it's a very important trigger of bad outcomes in patients that have heart disease. Talking a little bit about smoking, I don't want to go into detail because we know that smoking is not very healthy for us. 1 in 7 male adults in the United States still smoke. 1 in 9 female patients, they are still smoking in the United States. And what is more impressive is that 1 out of 9 high school students will have used an e-cigarette in the past 30 days, which is very alarming because these may lead in the future to smoking regular cigarettes with all its detrimental effects. This is a healthy diet. We've heard so much about eating healthy, which is based on fish, legumes, proteins, fruits, vegetables, and all that. A lot of my patients always ask me what diet I would recommend to my patients. And I like to say that I'm very flexible with the diet, and the diet that I usually recommend is the same diet that I have at home, which is called the Mediterranean diet. This is the only diet that has demonstrated to have a beneficial effect in patients that have cardiovascular disease, leading to a reduction in the incidence of stroke, myocardial infarction, or death from cardiovascular diseases. So the Mediterranean diet is the highly recommended for all my patients, and this is a diet that is based on olive oil, mixed nuts, and vegetables and fruits. So this is the classic pyramid of what we should be doing every day: physical activities, the type of fruits that we should be eating every day, the vegetables, fruits, whole wheat grains, olive oil, beans, nuts, legumes, and seeds. On top of that, fish and seafood. I recommend to all my patients to have seafood or fish at least once or twice a week, and staying away from red meats and sugar-based products as much as possible. Losing weight, very hard to do. We know about that. But talking about losing weight, the most effective ways is to keep track of the calories. What goes in, what goes out, that's very important. So we try to reduce the number of calories that we intake every day. We control our our portions, and we get active. I understand that doing regular exercise is very healthy, but it doesn't burn a lot of calories, but it's still very important. One thing I recommend to all my patients is to learn about the BMI, the body mass index, which is a value that is based on our weight and height. And usually we try to be at 25 or below, because it gives us a proportion of the appropriate weight for our height. So trying to be at 25 is ideal. Physical activity, obviously extremely important for cardiovascular disease, trying to be to exercise almost every day. Our recommendation is to do more than 150 minutes every week of moderate physical activity, or at least 75 minutes every week of very vigorous exercise. So we try to establish not to be sedentary, to be moving all the time, to count our steps. Nowadays, with our smart watches, smartphones, we can track the steps that we do every day. And therefore, that is very important to keep us moving, because moving is going to be very important for the heart, and also to start burning some of those unneeded calories. Like I said before, we have incorporated in the healthy lifestyle sleeping. Sleeping is very important. We recommend that most adults should sleep at least 7 to 9 hours every night. And it is not easy to do, but we understand that having a healthy sleeping habit will reduce cardiovascular disease, will help prevent cognitive decline and dementia, depression, and will lower high blood pressure and also our blood sugar and cholesterol. We are very, very attached to our phones, and one of the things that a lot of people do is keep looking at their phones at night, and especially if they cannot sleep, they go and look at their phones, and actually we know that actually that light from the phone will keep us awake, will awake our brains even more so, and then it's going to be even harder to fall asleep. Therefore, we recommend to move the phone away from our nightstand, dim it, set alarms to it to wake us up, to stop working, to stop the phone calls to come in, and just block it for a particular period of time, especially at night, so we are not awake by our phone. A lot of my patients always ask about mental health and stress and what can be done to reduce stress. We live in a very stressful society, and there are some minimal things that we can do to reduce stress, such as exercising on a regular basis. There are walking on regular basis, meditation, yoga, whatever works for you in order to reduce stress. We have to make time for our friends and family. We need to get enough sleep. We have to have a positive attitude to life. We need to practice relaxation techniques. There's plenty of apps in our phones that help us relax. And also we should try to find some hobbies that are going to be distracting us and getting us out of stress. Easier said than done, but I think it's very important. I won't talk a lot about diabetes. Diabetes is a very serious disease, and here we have a map of the United States where we can see the incidence of diabetes. And again, as you remember that first map that I showed you about the incidence of cardiovascular disease in the United States, we can see that these maps are very similar, and we can see in the southern portion of the country where we have a very higher incidence of diabetes, and unfortunately that is going to lead to cardiovascular disease. There's nothing more that we can do about diabetes than trying to exercise and to have a very healthy diet. We know that that is going to help prevent or try to reduce diabetes. We need to control our bad cholesterol. If we have elevated cholesterol, we need to control our blood pressure. And nowadays, we need to have an hemoglobin A1C that is below 7%. And that is the magic number that everybody should know if they have diabetes. High blood pressure or hypertension, very, very common. We call it the silent killer because usually we don't feel it, but it is there and it is going to have a bad influence in our heart, unfortunately. More than 122 million people in the United States, almost half of the population of the United States, will have high blood pressure. And we've become a little more strict on our blood pressure, and now we call normal blood pressure and anything that is lower than 120 to 80. We have those two magic numbers. One is the systolic blood pressure, the other one is the diastolic, the lower number. And we want this number to be below 120 over 80. Once it starts going up beyond the 120, we start calling it elevated blood pressure. And if it's more than 130 over 80 or 89, we call it high blood pressure. And stage 2, when it goes beyond 140 millimeters of mercury or 90 millimeters of mercury for the diastolic pressure. So we try to control with it. There are a lot of things that can be done. One of them is, of course, eating very smart, trying to stay with the Mediterranean diet, trying to reduce the amount of sugary drinks, sodas, try to prevent eating salty foods and all those snacks that we see very often. We need to be very active, move more, exercise more. We need to manage our weight, trying to get a BMI that is below 25. Definitely no smoking if we have high blood pressure, and trying to get a good night's sleep. And that will all help us control our blood pressure. And if that doesn't work, of course, we need to take our medications in a regular manner. There's a lot of information in the internet. Please be careful what you see and what you read. There's a lot of misinformation. A lot of patients come to me with very, very smart and very good questions, On the other hand, I see other patients that come with some things that are not so smart, that are not based on science, and therefore it is an issue. So be very careful what you read in the internet, and always consult with your physician about any changes. Like I said before, now at Mather, we have opened, it's going to be almost 3 years now. We opened two cardiac catheterization laboratories, one for coronary disease, one for electrophysiology. We've been very, very active, and we have received very good grades from the American College of Cardiology and from the American Heart Association. So we are there to serve you if there is anything that you need for your heart. So I will stop right now. If you have any questions, please feel free to ask them.
Yes, awesome. Thank you so much, Dr. Gruberg, for that extremely informational presentation. And like you said, if you have any questions, you can enter them in the Q&A feature at the bottom of the screen. I see we have one already. I was advised to eat walnuts. Can a patient eat too many walnuts?
That's what is too many. I think anything that we do in excess is not healthy. We have to have a balanced diet. For one person, eating a couple of walnuts a day is going to be too many. For other, maybe eating a whole bag is not going to be enough. I say the word moderation, and that's a word I use with all my patients. So I always say you can have whatever you want as long as it's with moderation.
All right. We don't have any other questions, but I will give it a few moments here. All right. Dr. Gruber, your presentation was so well that nobody has any questions.
I'm glad to hear that. But well, if anybody has any questions,
Yep, we're starting to get some in now.
Okay, I had EFAP had it removed. I'm not sure I understand that question. If you can spell it a little better and let us know exactly what you mean. It will be coming 1 year of my stent surgery. What testing will I need going forward? So that's a very good question. Any patient that had stents placed in the past, which is I like to presume that this was a cardiac catheterization and not an open heart surgery. We do not do regular testing anymore. What we do is we follow up with the patient on a regular basis. We try to control the risk factors, make sure that the bad cholesterol is well controlled, that the diabetes is well controlled, blood pressure well controlled, and we keep going. If there is any symptom or any change in any aspect of the heart, then that's when we start doing tests. We don't do the stress test every year like it used to do in the past. There were a lot of false positive, false negative in the past, so we don't do that anymore. So just keeping in touch with your cardiologist will suffice. Jonathan, I'm not sure if there's missing something in these questions.
No, I'm seeing the same thing. It's
At
it's not a complete question, but for that specific individual, you can always email us with your question. But we can just go to the next one. I can't eat nuts. What can I substitute?
Well, there's plenty of food that can be substituted. Fruits. I like to recommend healthy fruits for all my patients if they cannot have nuts for some allergy. Definitely fresh fruit is the thing I recommend to all the patients. Apples, oranges, bananas, they're very healthy, they're good. And that's my recommendation.
Is Plavix always prescribed after a stent is installed at left anterior descending artery, and for how long?
How long? Very good question. So Plavix is one of the blood thinners that is prescribed for patients that have a stent. There's another medication that can be prescribed instead of Plavix. Plavix is the most common one in combination with low-dose aspirin. The length that we prescribe aspirin and Plavix depends on where the stent was located and what was the reason why the stent was placed. In any patient that came in an acute setting, we recommend to be continued for at least 1 year. In patients that had what we call an elective procedure, 3 to 6 months may suffice. This is something that depends on a lot of factors. It's not an easy answer to say yes, no, and I would consult with your cardiology before making any change. And definitely, I would never stop this medication, even if your dentist or your primary care physician suggested, without consulting your cardiologist.
Okay. Here's that individual's question, Dr. Gruberg. I had cardioversion, electric reset of the heart rhythm in January of 2023. Is there a change that EFAB can come back and how to prevent it?
That's a very good question. So cardioversion, what it does, it restores the normal rhythm of the heart in patients that have atrial fibrillation. And usually we need to decide if the patient needs to take blood thinners with it or not. Unfortunately, there's not a lot that we can do to prevent atrial fibrillation from coming back. Sometimes controlling hypertension, controlling risk factors may prevent it from coming. But sometimes, and as we get older, the heart gets a little more stiff, and that will cause atrial fibrillation. And again, I would consult with your electrophysiologist. These are the physicians that they take care of the electrical portion of the heart to see if there's anything that can be done. Sometimes there are medications, antiarrhythmics, what we call, that can be given to prevent the recurrence of atrial fibrillation.
Next question. Is controlling everything require staying on my current dosage of medications?
Usually, the medications that we give at the correct doses are, what we need to control the diseases that we have. Obviously, nowadays there's a plethora of medications, and unfortunately, a lot of patients are taking a lot of medications for different diseases. Again, this is a good question that should be taken with your cardiologist, and I wouldn't recommend making any changes without consulting. Sometimes we do need more than one medication to control our diseases, unfortunately.
All right. And it looks like the last question, how often can you change the stent?
Or you cannot change the stents. Once we put those stents, they go there and they get embedded in the wall of the artery from the inside, and they become part of the wall of the artery. They cannot be taken out. So we don't change them. Unfortunately, in a very, very small percentage of patients, we can see that they re-narrow. And like I said before, these new type of stents and medicated stents will prevent this re-narrowing. But in about 3 to 5% of patients, the re-narrow may occur because of some scar tissue formation. And in those cases, we can add one more stent, put another stent, or we can use medicated balloons, or we can use radiation. There are other options that we can use to treat this event.
Sorry, it looks like we got 2 more questions. Is there any cure for the bundle branch block?
Bundled branch block is a problem with how the electricity in the heart is moving around. Usually the electricity in the heart moves through 2 big bundles. One goes to the left, one goes to the right. And sometimes they will get blocked. The electricity will not go through one of these nerves. And then the electricity has to go around the heart. Usually this is not a big issue, and a lot of people will have it as long as we know that it's happening. It doesn't have a very big impact in the heart. The problem arises when we have more than a bundled branch block, and then the heart becomes the rhythm of the heart becomes to slow down. In those cases, there might be a need for a permanent pacemaker. A bundled branch block per se is not a problem. People live with it normal lifetime.
How good is walking for the heart?
Excellent. Walking is very, very good for the heart. Highly recommend it. I like to recommend people to walk every evening on a regular basis. I recommend not to do it with the dog because then we stop all the time. I recommend it to do it as an exercise. So if people can go out and just walk for 30 minutes at a fast pace, that is extremely healthy for the heart. And I like to recommend moving the arms as we are walking. Looks a little dorky, but on the other hand, is very healthy for the heart.
Awesome. That looks like it was the last question. So I just wanted to thank you, Dr. Gruberg, for your amazing presentation. If anybody has any additional questions, you can email them all to matherhospital@northwell.edu. Once you exit the webinar, you will see a link to complete a brief survey. Your feedback is extremely important to us and helps us plan our future programs. And if you'd like to view past HealthyU webinars, you can view them at www.matherhospital.org/healthyu. Thank you all for joining. Thank you again, Dr. Gruberg, and enjoy the rest of your day, everybody.
Okay, have a great day.